Within hours of taking office on 20th January, the US President Donald Trump announced an immediate 90-day freeze on all US foreign assistance. The major impact is being felt by projects under the US Agency for International Aid, USAID. On ground where the support was consumed, the panic button was pressed. At the Infectious Diseases Institute, a yearly 33.8 billion shillings funding for 2 of 6 key projects is affected. Dr. Kambugu is the executive director of the institute.
The first one is a capacity building project for tuberculosis. Essentially, we've been getting about $6.5 million every year to work with the Ministry of Health to strengthen the way we look after TB patients. Very simply, what the money helps us to do is, one, help us find people who have TB. So the second project is about orphans and vulnerable children. So we've been doing a number of support activities for these children, including educational support, support for health. And so this is also one other affected grant. We've been getting up to about $2.7 million per year.
Dr. Kambugu says a great number of the workers have been placed under hold since the freeze on the aid.
40 staff centrally, but also 240 community workers supporting that effort.
With over 80% of the country's health projects, especially those supporting people living with HIV, reliant on this aid, there was a cause for concern for the future of 1.4 million Ugandans living with HIV. This, despite a waiver for life-saving humanitarian assistance. But the Ministry of Health has been implementing the differentiated service delivery model since 2020 in partnership with the Academy for Health Innovation at the Infectious Diseases Institute. It has adopted and scaled Art Access, a web-based system. The system supports the community private pharmacy refill model that allows patients to pick up their free government-supplied ART from private pharmacies close to them.
So now Art Access is being scaled up in partnership with our colleagues in the ministry and with the support of the US CDC to 160 pharmacies. And right now it's serving 50,000 patients. So it means that we don't need to congest Molago, we don't need to congest a regional referral hospital. When a patient goes to pick medication from a private pharmacy under Art Access, the pharmacy is paid 2,000 shillings. Previously, the US government, through USAID, has been paying that 2,000 shillings.
Because missing a few doses would result in a risk of drug resistance and other related life-threatening complications, for some, including people living with HIV like Grace Mukankusi, not her real name, can now afford to keep living positively.
I like this system because it is less strenuous and I don't incur any transport charges.
December when we started, by the time we started, yes, we had about 20 patients. But currently the system holds about 1,500.
But previously when we used to use the paper-based, you could find here a lot of people. The people living with HIV who have come for the RVs and our other clients who have come for these other usual prescription.
However, government has since found a backup with other partners like the World Bank and Global Fund to plug some gaps. But for Dr. Kambugu, this is the right time to take the first step into self-sustenance.
The US government has supported us for 20 years and we've built great capacity. We've trained people, including myself, using US government support. We've renovated all sorts of things, labs, pharmacies, stores at government hospitals. We've renovated health centers. We have distributed hardware and software using these resources. What I'm trying to say is that certain capacities have been built. And even though this has happened, we have the opportunity to ride on that capacity that has been built.
Although a waiver was issued for medicine and life-saving humanitarian assistance, the incident exposed how fragile healthcare access remains for people living with HIV in Uganda. Walter Mwesigye, NTV.